My name is Nimisha Mishra, and I'm an infectious disease doctor. Thank you, Dr. Navneet, for the introduction and for the you know um, discussion about kids. I am an adult, like I'm an internal medicine physician, so I mostly treat kids. I mean adults. So it's always good to hear from the little kids' point of view what all is going on. So yes. The data is we are all impacted. Like for a year and a half we've all been dealing with this COVID pandemic, and it's interesting um how this, like, it was already going the way it was going. We were just starting to see a little dip and we were starting to take a little breath, and then this whole thing changed by the Delta variant. So I think it's important for people to understand why it's different and what's new about it, because many people will say we've been dealing with it for a year and a half, what's new? So that's what I think we were trying to talk about. So I did try to put together some slides so that people who are listening in can get some perspective of why all doctors and why all of us are so worried and why we are seeing what we are seeing in the news, because um, I guess pictures say 1,000 words. That's why. So I guess if we can start off with the slide, Vidya. Okay. So all right, thank you. So that's like so I wanted to say is like when we started off, it was this one COVID variant, and it's being called the ancestral variant. And like any other virus, so COVID is not different in this way. I like any other variant, any other virus, I should say. Every virus, all it does, it keeps on changing all the time. So that's what all viruses do. So that's exactly what the COVID virus is doing also. So it keeps mutating and changing all the time. But what happens is there are certain changes that will take on a life of their own, and some will just mutate a little bit and not be anything different. So that's why we are talking about these different outbreaks, like they're being called alpha, beta, gamma, and then this Delta variant. So I think there was a lot of confusion in the world because this is an Indian strain or this is the UK strain. So they have come up with these names. So that's why this Delta variant is called this B1617.2. So any other numbers like after this, I think there's a Delta plus variant also, which has come up with a B16.17.4 kind of thing. That's why those numbers are there. So next slide, please. So, all right. So like Dr. Naveed was telling before, so I think the number change that happened in children kind of came in August, but where the CDC started seeing, this is how they track, the number of cases and number of deaths in these two pictures you can see. So, when it started off last year in April, and then the peak was during the December, January time. And then as you can see, the cases happen first and the deaths kind of lag behind. The curve always lags behind about 2 weeks from the cases data. And then there is this striking number that drops over here in January, as you see. I think that is where we started seeing the vaccine kick in. So you can see how the numbers started going down, and then it kind of plateaus a little bit, and then it got down even lower, interestingly, in April. And then in early July, actually July 6th, people were starting to, relax even more. You can take off your mask. Things were kind of getting like, very relaxed. And then you see on this curve, it seems like a very little blip on the end, on the right side edge of this curve. But if you blow it up, you'll see in the next slide, please. So you'll see how they blew up this right edge of the graph. And by statistical, like epidemiologic numbers, 50,000 cases are anything more than 50 is called like significant. So you can see between July 6th and July 28th, in just 2 weeks, there's a 400% increase. That's how many cases increased within 2 weeks. So that's like really significant. So I think that is what caused this panic and alarm, like there's something different that's happening. It's not just the regular COVID virus that's going on. So that's important. Next slide, please. And this is the same data being shown in a different kind of way, that they showed that the nationwide cases, how steeply they rose in 2 weeks by 400%. So if you see this, the map on the left-hand side, like only 24% of the counties had substantial to high level of transmission, which is in red and orange. You can see those, about 24% July 6th. And then 2 weeks later, the whole thing is just lit up. Like the whole thing is like red almost, you can see. 67% of the counties are involved. That's how fast it spread. So of course, like there's something different. So one slide, yes. Next slide, please. Go ahead, yeah. So, and then this is kind of another way of showing what I was saying, that there are different variants. So as I was saying, the B1.617.2, that's our Delta variant. So that's in this dark orange. So you can see like initially this B117, that's like the alpha, that's the alpha variant, that was the UK one. You can see that that was more common in April, how that beige one kind of keeps shrinking. It's shrinking and shrinking from April, and how this deep orange is kind of just filling up the screen. The whole thing is filled up with this Delta variant. So this last is like July 17th. And then in the next slide, please. You'll see this last one is in August 14th. So it's like 2 more weeks go by, and you'll see the whole thing is full of this Delta variant. So this dark orange, well, there's another darker orange on the bottom. That's actually the Gamma one. That's another one that is kind of staying the same. It's not going away. It's kind of staying the same. But this one is definitely like more than 90% at this point is all over the country. It's 90% circulating around. That's why it's so, it's just taken all over. Within 2 weeks, it spread that much. So, all right, next slide, please. So I think what I'm trying to say in different ways is that the Delta variant is way more contagious, and they've seen that it's actually more, it can cause 2 times more infections. So it's almost not just 2. So if before you were infecting 2 people, now you're infecting almost 5 people. That's how much it's spreading faster. And the only way you can really there's many things you can do, but the one thing that we have is vaccines. I guess the vaccine is what protects you from hospitalization, deaths, and severe infections. So next slide, please. So there are a few things to know. I think if we can remember those, is that it's more than 2 times contagious as the prior variants. That's why the chances of catching it are much easier than it was before. And this is not fully vetted yet, but this is being said that some studies like in Canada and Scotland are showing that in people who are unvaccinated, the Delta variant illness can be way more severe than the prior strains. The greatest risk of transmission is still amongst the unvaccinated people. So people who, like most of the people that we are seeing, majority of the people that are getting the infections are unvaccinated people. And it is true that fully vaccinated people can have and are having breakthrough infections, but majority of the times they do not get admitted to the hospital, and their infectious timing is much shorter. So they are less likely to spread the infection to as many people because they're infectious much shorter of a time. They're not that infectious for that long compared to unvaccinated people. So that's something to remember. And then this is actually very important. So, I find this very surprising that even though this was like rapidly done for children between 12 to 17 years of age for vaccination, At this time, only 30% of children are vaccinated. I mean, it's not even 50, it's so low. It's kind of surprising to me because, I mean, I don't understand why, but anyways, 30%, only 30% kids are vaccinated in that age group. And of course, as we know, less than 12-year-old are not even approved for vaccines right now. They're working on it. The ACIP are meeting, they are working on it, but they haven't approved it yet. So, and I think we all understand most important thing is to vaccinate anyone who is eligible. And for those kids, so this is another question which again gets asked many times. What do you do for kids who cannot be vaccinated? I think for them, it comes down to the same thing, what we were doing last year before the vaccines even came around. You cannot emphasize how much, like social distancing, hand washing, just trying to do all the measures possible to kind of avoid them getting infected. Because, even though we say less kids are being infected, but kids are being infected. It's not true that they're not infected. So next slide, please. And then this is like the importance of vaccination. I find this slide very interesting because, like, for all the people, like, just to kind of put it in perspective, the most vaccinated state is Vermont over here on the right side, like between 65 and 70%. And look at their rate of infections, like 7-day case in 100,000. And then look on the left-hand side at all these like southern states like Arkansas and Louisiana and everything, like they're all so high. California kind of falls somewhere in between, like 50 and 55%. So I think this is a very interesting picture. It kind of shows you the same thing in a different graph. And the next slide is showing the same thing. It's in more like picturesque form. Like the blue one on the right side is kind of sitting cool. The ones on the left are all red and, they're highly infected, they're infectious, they're spreading, the risk of infection is really high on that side too. So next slide. And the same thing in the graph is saying if the vaccination coverage remains low, then the transmission continues to be high. So the purple areas, as dark as the purple is, you can see those areas are, the vaccination numbers are low, and the high transmission, those are the high transmission areas. So it's kind of going hand in hand, and all these other areas. So what is being like 40% is like, I think they're using off 40% as a cutoff. So I think that's what the purple and the white are showing. Next slide, please. And then this is another slide to kind of put, so this is another thing that has happened from last year, is like there's so much data out there, numbers, like how much percent. So I think this kind of crystallizes it for anyone who wants to see, like, how when, so if we see the first numbers on each side, when we came out with these vaccines, this we know this this is the Pfizer BioNTech vaccine over here that they're comparing. So for alpha symptomatic disease, it was 94% effective, and for hospitalization, it was 95% effective. And then if you see for delta, for hospitalization, this Pfizer vaccine is still 96% effective to avoid hospitalizations. For symptomatic disease, they're saying 88% because they are seeing breakthrough infections, but that's still symptomatic disease, as in mild symptom disease. You won't be hospitalized. So that is very important to remember, that I think we're still lucky that despite how contagious this virus variant is, the vaccine we have is still very effective. So that is a very important number to kind of remember, that it's a very effective vaccine still. Next slide, please. So this brings me to, again, the take-home points. Like if you don't, like whatever I was saying, getting vaccinated prevents severe illness, hospitalization, and death. So that is very important. Yes, because we are seeing breakthrough infections, but they are mostly mild or asymptomatic people. So what it does prevent is severe illness, hospitalization, and death. And besides this, this is benefit to the person himself or herself, but it also helps reduce the spread of virus in the community. So that is very important, but because you have to remember every vaccine that you take, you are not just vaccinating yourself, you're helping yourself, but you're also helping the community at the same time. So that is kind of like a community service and personal service at the same time. So that's when you get vaccinated, you prevent your own illness and you help reduce the spread of virus in the community. So it's both these steps are very important. So the next one is unvaccinated, no, sorry, go back. Sorry. The unvaccinated people should get vaccinated and continue masking until fully vaccinated. So that's something that the CDC is saying, that till you get a vaccine, please stay. I mean, they're saying masking for everybody anyways, but if you're unvaccinated, then please stay masked until you get fully vaccinated. And with the Delta variant, this is becoming even more urgent. The highest spread of cases and severe outcome is happening in places with low vaccination rates. So it's very important. Next slide, please. So, and as I said before, Delta is more contagious than all prior strains. Some vaccinated people will get breakthrough infections and they become contagious then. Despite this, the vaccinated people represent a very small amount of the transmission occurring in the country. And mostly all hospitalization and deaths continue to be among the unvaccinated. So that's important. Next, please. In areas with high transmission, CDC recommends everyone, including vaccinated people, wear a mask in public, indoor settings to prevent the spread. And CDC recommends community leaders to encourage vaccination and masking to prevent further outbreaks in these high-risk areas. I guess that's what Dr. Navneet and I are doing right now. And CH it also recommends universal indoor masking for all teachers, staff, students, visitors to K-12 schools, regardless of vaccination. Kids are to return to school with layered prevention strategies in place. That continue to say. All right, next slide, please. So again, the most important point that I did not mention enough before is please vaccinate, vaccinate, vaccinate. That is the one thing you have to do. There's very few reasons where you should not get vaccinated, very, very few reasons why you should not be vaccinated. So, you know, like when we talk about the armor, body armor, you're going into war, you have to wear some protective armor. This is your armor. If you don't have that, you're going into battle without the armor. That's how you should think about it. Thank you. That's the end of my slides.